So healthcare is a good time to also bring in a broader discussion. So stepping back a little bit from the COVID-19 pandemic, perhaps, and stepping back from critical standards of care and really tough decisions about allocating resources, in that sense, we can step back and look at the economic system that we're in and what that means for the healthcare system that we have. And by that, I mean, we this healthcare is a good time to talk about capitalism versus socialism. So capitalism is a society where decisions about how resources are distributed and used are made based on a market economy. So people making buying and selling decisions, individuals are making choices, and that's how we end up having a flow of goods and services through the economy. There's no centralized planner. It's a decentralized system. So you can contrast that with a socialist system, which a kind of simple way to think of it, a pure form, is when the government owns all of the means of production. That's really what it means to be socialist. Government owned or controlled resource. So goods and services are made by the government, or because the government says they will be made, is the one making those decisions and deciding where they should get distributed to, who should get them. Some communist countries have had socialist systems. There have been democratic socialist countries where it's not a authoritarian government, it's a democratic government, but it does have a lot of government involvement in decisions about things. And so, maybe a place like Scandinavia, they're fundamentally a market economy still, capitalist, but there are certain segments of the economy that are much more socialist, certainly than the US, and healthcare is one of them. So healthcare is a great time to talk a little bit about what that means and some of the moral issues that kind of undergird them and come up in them. And so in the United Kingdom, they have a national health program. They have socialist medicine, essentially. So the government is the one who owns the hospitals and the doctors' offices. The government is the one paying the doctors and the nurses. So when citizens have to get medical care, they're not paying for it. There aren't insurance companies paying for it. It's being paid for by the government. So taxpayers are the ones paying for the health care. So it's much like our highways, right? Our highways are not something that, for the most part, toll roads people pay for when they drive on them. But for the most part, our highway system is something that we taxpayers pay for, right? And in Britain, that's pretty much how healthcare works. So everyone can get healthcare. They usually don't have to pay out of pocket to get it. They get it when they need it. Now, there can be problems. You can run into queuing when you have to wait to get the healthcare you want, and that especially becomes an issue with specialized procedures. You need some advanced treatment for cancer. You may have to wait a little while. There are limited resources, and there's that aspect of rationing that we've already talked about. You have scarce resources. You have to decide who's going to get them, and typically a queuing system means the first come, first serve. There's a line, and you make your way up the line. And we have systems kind of like that in the US. If you want to get an organ transplant, then you're going to have to put your name on a list, and it's going to be a while. It's not a pure first come, first serve system. There's some other elements of priority that can get you to move up or down the list, but roughly speaking, that's how it works. And that's actually a pretty fair analogy to a lot of specialized procedures in a place like the UK. Now, if you go to a place like, say, Canada, The government doesn't own the hospitals, doesn't directly pay the doctors. So it's private, market-driven healthcare providers. But it's different from the US system in that there's a single payer. So the government is actually the one who pays them. You could think of it as the government is the one who runs the health insurance company that everyone is on in Canada. And the premiums are paid through your taxes. So that's how you could think about a single payer government system. So it's different from the UK because the government doesn't own the hospitals and directly, have the doctors as government employees. But it's different from the US because instead of private health insurance companies, the government is the one who has basically one big health insurance company that has everyone covered. And so in the US, we actually have something like that for people who are older, 65 and older, Medicare. We also have a Medicaid program that supports low-income people. Some disabled people get covered. So we have some element of single payer, much like Canada. We do have some, if you're a veteran, you may be eligible for certain care through the VA system. That's much more like the NIH in Britain, where the government is running those VA hospitals, right? But fundamentally, most of what we have going on in our healthcare system is that it's private, market-driven, both provider side and insurance side. So most people are not covered by a single-payer government system. Most people are paid through employer-sponsored health insurance programs. So I get my health insurance through Western Kentucky University. That's the most common way for people to have health insurance in the U.S. And so we're definitely more on the capitalist end of the spectrum, if you think of it that way. A place like Britain is pretty far over toward the socialist side of organizing how it does medicine. And you could get an even more extreme example, a place like Cuba, where it is explicitly a socialist system of healthcare. Now, these all have advantages and disadvantages. The biggest one, the most fundamental kind of trade-off that you face as you move along the spectrum, if you're in the US system, there's a large amount of liberty, autonomy, choice. So individuals have a lot of choice in one way or another about the healthcare they're going to get. They choose their doctors, they choose even what health insurance they're going to get, maybe by choosing what job they get, but there's some element of choice and flexibility to it. No one's forcing people to get most things, with some exceptions. The individual mandate of the Affordable Care Act, you could say that forced people to get health insurance, but it's actually been zeroed out, so there's no penalty. So even that's probably a moot point now. And so that's good, right? Having choice, being able to make your own decisions, not having people tell you what to do, that's kind of, that's liberty, and that's a good thing. Now, on the other end of the spectrum, in a socialist system, everyone is covered. It's universal, right? And so that's a good thing. There's no one who is lacking healthcare because they don't have the means. They don't have the ability to pay. And so that's where the trade-off comes up, is that in the US system, by having a lot of choice, by having a lot of autonomy and liberty, we don't have a lot of equality. We don't have a universal element when it comes to healthcare in the US. There are a lot of people who are lacking the ability to get adequate healthcare. Now, there are some options. There are emergency rooms and certain clinics that don't turn anyone away if they need care. But that's a far cry from being able to go to any doctor you want to and not having to worry about money, which is much more the socialist system. Now, over in that socialist system, there's the downside of not being able to choose as much, and a lot of times you end up not having a choice of what doctor you're going to go to, and finding out you're going to have to wait for a long time to get care that you need. That's certainly not ideal. That's not good. So there is a trade-off, and there's a very healthy debate in the U.S. about whether we're in the right spot, whether we need to get more market influence, or whether we need to move more toward universal coverage, single payer, more towards socialism. It's a tough trade-off to move along that spectrum, and so not surprisingly, people disagree quite vehemently on where we are and where we should be. So healthcare is definitely a good context to think about this capitalism versus socialism. To pull in some of our philosophy terms, the capitalist system offers a lot of good libertarian principles that undergird it, right? The socialist system has a lot of good egalitarian principles undergirding it. And so there we are. I ask in our writing assignment to have you, as you think about healthcare in the U.S. in a context, to tell me a little bit about how your thoughts on the healthcare kind of sync up with your general sense of preference for capitalism, socialism, spectrum. And I'm asking you to do that not because obviously there's a right or wrong answer on where you put yourself on that spectrum. That's not what it's about. It's a prompt to get you to think about how, looking at the context within healthcare, it's interesting to step back and see how that relates to a broader picture sense, whether that's one that's well developed for you or one that you haven't really thought much about. It's a good exercise to go through. So that does it for our week 2 lectures. I look forward to seeing you guys again for week 3 soon. Thanks.